Welcome to the October 11th, 2023 regular meeting of the Washington Township Healthcare District Board of Directors. I'd invite you all to join with me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Public notice for this meeting has been posted appropriately on our website. Tonight's meeting is in person in the boardroom at 2000 Maury Avenue, Fremont, and is also accessible by Zoom. I ask that you mute your system until such time as you need to speak. We are recording tonight's regular session of the board meeting, and it will be posted on our website for future viewing. Cheryl, if you'd take the roll for us, please.
Director Stewart.
Present.
Director Nicholson.
Present.
Director Wallace.
Present.
Director Yee.
Present.
Director Ethan.
Present.
Thank you, Cheryl.
You're welcome.
Our first item is communications. Oral communications. Members of the public are invited to speak during oral communications. When prompted, please state your name for the record, then proceed with your statement not to exceed 3 minutes. On issues or concerns not on the agenda and within the subject matter of jurisdiction of the board. We have several people here tonight that would like to speak to us. I'd invite, first of all, Donna Mapp.
Good afternoon, everybody, members of the board. Thanks for having us here. My name is Donna Mapp, and I am the representative for the workers of SCIU UHW. Everybody that's sitting back there. It was great humility and humbleness that I addressed the board for the second time. We have addressed the board in the past. I myself have spoken before, and several members have spoken, including folks who is in the audience today. And we come to you again to say that we have been at the table as a collective bargaining agent of SCIU-UHW with management, Washington Hospital, to renew our contract, and both sides have proposals on the table. We have been 6 months since we have been at the table. April 12th was our first bargaining session. We are literally at the table today, right now, and just happy that the board is here today. We want to just let you know that we have come to the crossroads of this bargaining. We made our concerns well known several times, and we're here to say it's time to bring it home. We have given management a proposal, and we are saying that we as healthcare workers, we deserve what we are asking for. We are willing to put in the work that it would take to get what we're asking for, and as the board, we're asking you to consider and listen and hear. I'm assuming that you're getting feedback from the negotiator and the management staff who is at the board, and we want to make it quite clear that we are very serious about it. Here is the members who support and work at this hospital. We operate Washington Hospital, and we just want to make it quite clear. It's the workers here that run this hospital, and we cannot kid ourselves that the workers here do not run Washington Hospital. When Washington Hospital was in bid for the accreditation to be a trauma hospital, we got calls from the management team here. Our political department was willing and ready to step in. We defended Washington Hospital
30 seconds.
When the decision was to be made. It's time for us to do right by the workers here. Kid you not. We are ready and prepared to fight for what we deserve, nothing less. Let it be known again, we are ready and prepared to fight for what we deserve as healthcare workers. So do the right thing, because we are tired, and it's time to bring this contract to an end and wrap
3 minutes.
Thank you. Thank you very much.
Thank you. second speaker card I have is for Regina.
Good evening, everyone. My name is Regina, and from EBS, and I'm here again to represent my department and with the RT and PT and CNAs all concerned. And we're sticking to our concern, which is the cost of living. 2 years ago, we had
Recording, you may hang up.
by the fence that says, grateful for our heroes. What does that really mean to us? Who are the heroes? Behind you, who are sitting on the wall, or by the wall, are all heroes. Those are the brave people who cleaned COVID rooms, with rooms with cabins, all of those, you name it. They cleaned it for us, for this hospital. And we feel now that we're the LALO, we're the last, and we have the least offer. So I hope you listen to us. Please give us more. We feel that we deserve more, and that little thing that you do for us will take us far, especially for our family survival. We have some revelations to make, if not most of us, if not all of us, most of us. That now we have 3 companies after us. Not Kaiser, not Stanford or Sequoia Hospital. It's the water, electric, and gas company. Because pretty soon, maybe we will be on their delinquent list, we will be behind from our bills. It hurts. We feel like we're being belittled and ignored and rejected. So please understand where we're at right now. And like before I said, I was concerned with my grandson. And now, believe it or not, my daughter was helping me with the laundry, and
30 seconds.
he pulled up my underwear. He said, "Oh, Mom, you have this underwear, it's like parachute." I was kind of embarrassed. I said, because I didn't have extra money to pay for that. Instead, I have to pay for food, which is our necessity. So please listen to us. There's a saying that rivers
3 minutes.
penetrate rocks, not because of power, but because of persistence. Yes, we are persistent, and we stay hopeful that you guys, the bosses, our directors, board of directors, and Madam Kimberly, to please consider our plea.
Thank you.
Thank you.
I also have a speaker card for Emmanuel Rivera.
Esteemed members of the Board of Directors, my fellow frontliners, ladies and gentlemen. After 6 months of labor negotiations with Washington Hospital, we stand before you as representatives of the SEIU United Healthcare Workers Union with a message that weighs heavily on our hearts. These negotiations have been difficult and often gut-wrenching, as Regina would have said, and all the frontliners that spoke before me. Yet, we are here again today because we believe in the well-being and livelihood of our dedicated SEIU members who have tirelessly served the Tri-City community. Time and again, we've emphasized the struggles of our members who face the challenges of keeping up with the rising cost of living, inadequate wages, and compensation that does not match the hardships they endure on a daily basis. We've sought resolution through closed-door negotiations and have made significant concessions on our behalf. However, we have not achieved an agreement that ensures a living wage and nominal health care coverage that our members deserve. Last Friday, we issued a 10-day notice for an informational picket, set for Tuesday, October 17, 2023, between 11 a.m. and 3 p.m. This is not a step we take very lightly. It's a decision born out of our unwavering commitment to our employees and our desire for a fair and just outcome. We hope that Washington Hospital will reconsider their offer and stand with us as we work towards a resolution that benefits not only our employees, but the well-being of our entire community. We believe that it's time for the residents and taxpayers of the Tri-City community to be the judge. We must not forget our 520 SEIU members who have been on the front lines and who have collectively fought the wrath of COVID and its aftermath. Thank you for your attention, and we look forward to your understanding and support in the days to come.
Thank you. Thank you.
Thank you. I have no other speaker cards. We welcome you all here tonight. You're a big group, impressive number of people here tonight. We appreciate you being here and bringing your messages. We really do. Our meeting now is going to continue on other subjects and other things. And you're welcome to stay for some of those if you'd like. But if you'd like to return to your other duties and homes, we'll let you do that right now. Thank you again for being here.
Thank you.
I'll proceed with our agenda tonight. Second of all, are there any written communications?
No communications.
Fine. Then we're going to move on to our consent calendar. The consent calendar consists of agenda items that the board will approve with one motion unless either a member of the board or a member of the public requests to remove an agenda item from the consent calendar. If any items are removed from the consent calendar, the board will take action on the removed agenda item later in the meeting under the action item heading of the agenda. Does anyone on the board want to remove an agenda item from the consent calendar? Seeing none, does any member of the public want to remove an agenda item from the consent calendar? Hearing none, may I have a motion to approve the consent calendar items A through Q?
Mr. President, I move that the Board of Directors approve the consent calendar items A through P.
I'll second that.
We have a motion and a second. Cheryl, if you take the roll on that, please.
Director Stewart?
Aye.
Director Nicholson?
Aye.
Director Wallace?
Aye.
Director Yee?
Aye.
Director Epen?
Aye. Thank you. That motion passes. Now move to our presentations this evening. We first of all have the Alameda County Junior Livestock people here to present their findings tonight. Kimberly, if you could introduce those for us.
Yes, it is my pleasure this evening. We're going to have a presentation on Washington and what we've done with the Alameda County Fair Junior Livestock Auction. And I'm going to just introduce Angus Cochran, our Chief of Community Support Services, and then he is going to introduce our other guests that are here this evening to talk about it. So Angus Cochran has been with Washington Hospital Healthcare System since 2006, and he currently serves as the Chief of Community Support Services. In this role, he is the liaison to the Service League and manages community outreach and the Health Insurance Information Service. He is also responsible for governmental affairs for the healthcare system. He earned a bachelor's degree from UCLA and a doctorate from Columbia University. So I am going to turn it over to you, Angus, and I know you have some individuals that you would like to introduce and have a presentation.
Thank you so much, Kimberly, and thank you also to the Board of Directors for allowing us the opportunity to speak this evening. We have a PowerPoint. Shri, if you could share that through Zoom, that would be great. Perfect. All right, yep, so thank you so much, Shri. Yep, so we're here, and I'll take the next slide as well. So I'm just very much here just to do a quick introduction, set the context, and then we have three fantastic presenters this evening to talk about their projects for the Alameda County Junior Livestock Auction. So I'll introduce things and then pass it along to the students. Next slide, please. So each year for the last, I would say, at least 10 years, maybe more like 15 years, we have participated in the Junior Livestock Auction, which takes place towards the end of the Alameda County Fair every year. It's a full day auction where students from a lot of 4-H clubs and the Future Farmers of America program at Livermore High exhibit their animals, and there is an auction where people can bid on those, and we generally each year we are the #1 bidder for the auction. I have to thank Chris Henry, our former CEO, who has represented us for many years at the auction and was showing me the ropes this year, which is quite a feat because I really was out of my depth most of the time. I also just want to mention that our participation in this began in a project with Alameda County Supervisor Scott Haggerty, where they were rebuilding the barn at the Pleasanton Fairgrounds, and we helped with that project. Next slide, please. So our participation in this is really built around working with the local 4-H clubs, particularly the Bayside 4-H Club, which is based here in the district. As you'll hear a little bit later, the Bayside 4-H Club has their animals at Ardenwood Farm, but we also work with the FFA program at Livermore High, as well as the other 4-H clubs that you can see here. And in terms of why it is that we are involved with the livestock auction, I think it's part of our investment in the community in Southern Alameda County. It's about supporting youth in our district and about building their business skills around their projects. It's also about helping them develop skills that they then can take on into careers later on after they leave school. And it's about being able to kind of help our employees too, who also have children who are involved in these clubs. So for us, it's a very much an investment in the community, and it's a way of showcasing our commitment to the participants in the district as well. Next slide, please. So the main way that we participate, obviously, is we purchase some of the livestock that's up for auction. And this year we purchased 9 hogs, 5 lambs, 3 goats, and half a steer. So you can see the picture here, Supervisor David Haubert. We went in with him on a steer because a whole steer is an expensive endeavor and also a lot of meat. So we got a half a steer each. And we take the meat that we get from these purchases and we serve them in the cafeteria, and we also serve them to patients. And it has to be said, this is some of the best produce you can find. It's all hand-reared, organic. These animals are really well looked after, and I've heard no complaints about the pork chops or lamb stew so far. So moving on from there, I'd just like to introduce our first presenter. Next slide, please. Our first presenter is Rowan Batchelder. Rowan is here with us. We had the winning bid on his £141 market lamb, and Rowan is a member of the Redwood 4-H Club. If you could unmute yourself, Rowan, I know you've got a couple of slides to share with us. Next slide, please, Sheree. Take it away, Rowan.
All right. Hello, my name is Rowan Batchelder. I am in 6th grade and I go to Creekside Middle School in Castro Valley. I love math, history, and playing trombone. So far, I have joined 5 clubs other than Redwood 4-H. Rodeo Club, Fishing Club, Badminton Club, Video Game Club, and Chess Club. I find trains fascinating and I love playing soccer. I'm one of 3 kids at my school that does 4-H. Raising a sheep is harder than it sounds. First, of course, you have to pick your lamb. You want the squarest hind end, but you also want to make sure the legs are wide, the feet are square, and that you have that your lamb's back is straight. No dips. Once you have your lamb, you have to feed your lamb and work with them so that they have plenty of muscle. So make sure you walk them a lot. You also have to train them a lot to get them ready for the show ring. Finally, when it's time to go to fair, you load your animals into a trailer and you take them to fair. Next slide. After you show each of your lambs for market, at fair you show each of your lambs for market and you pick one of them to show for showmanship. No grown-ups are allowed to touch your lambs, so you have to take care of them yourself. Even touching them up with clippers before you show them. Your first year is kind of crazy. When you're done, it's done. You did it. But as the years go by, you start to see how you need to improve, and you do improve. This coming year, I know I need to work with my animals more than I did last year. My lambs this year did not have enough muscle. From looking at the carcasses, they were pure white with fat. So I know I need to start working with them a lot sooner. One of my lambs was a brute. We named him 49er due to his scrapie's ear tag, which was 49. And boy, he took that name seriously because he acted like a linebacker. My first auction day was the most nerve-wracking and most exciting day of my life. In line with my heart beating 1,000,000 times a minute while holding my sheep, I held true to my nickname, Smiley, and just kept smiling. I knew I needed to get at least as much back as I spent on the lambs, their feed, and other small costs. I spent a total of $1,262 for 2 lambs. This year, my average recovery cost was $5 a pound, which I definitely made back. Maybe it was my smile, or more likely was that my mom, had set up an interview with Washington Hospital, and Mr. Henry bid on my sheep and bought it. Without the sponsors to purchase animals at the junior livestock auction, I couldn't have done it all. None of us could have. So, thank you, Washington Hospital, for supporting me and all 4-H Livestock Project members.
Rowan, thank you so
Thank
much.
you.
Yeah, thank you.
Yeah, you're most
Thank
welcome,
you.
Rowan. Thank you so much for taking part this evening. And you can see in the bottom center picture there, a picture of Rowan and his famous smile. You definitely smiled your whole way through the auction. It was fantastic. Next slide, please, Sheree. So our second presenter this evening is Phoebe Chu. We had the winning bid on Phoebe's £138 market lamb, and Phoebe is also a member of the Redwood 4-H Club. So if you want to take yourself off mute, Phoebe, and tell us about your project.
Hi, my name is Phoebe Chu. Next slide, please. So Next slide again. Sorry. I am a junior in Castro Valley High School right now, and I live in Castro Valley with my parents and older brother. I have a hobby of reading, and I do sports including swimming and horseback riding or jumping. I like all animals, and I plan on studying animal science in college and to become a veterinarian in the future. Next slide, please. After picking out my lambs from the breeder, I have to spend time with them, getting them used to me. I have to walk them, let them know me more before I start training them. Once they feel more comfortable with me, I have to work on their legs and then let them loose for halter-free walking. After that, I did further training, which honestly depended on the personalities of which lamb I had. Next slide, please. For the break-even price, I usually keep record of all of my expenses for both my lambs so I can analyze how much money I need to make back for how much I've used. So I've spent about a total of $1,600 on my lambs. So to break even, one of mine would have to be purchased for about $12, which was purchased for $12. And then the other lamb would have had been to my net profit lamb. Next. A few challenges I had were just the training in general. It was really frustrating to find time to work with them since I had a lot going on at the time since it was spring and nearing summer. And one of my lambs are also really stubborn, so I had to take more time and patience to work with them. And something I learned better was time arrangement. In previous years, my lambs were trial and error. I've learned a lot over the years, and I just have to had more patience in general since I would have never done as well as I had this year. The day of the auction was hectic and fast-paced. I had to help the others prepare the lambs before I prepared mine because my lambs were scheduled to be auctioned off later than others in the club. And it was pretty chaotic since it was really crowded and both my lambs were placed really close to each other in the process of getting auctioned. But despite everything, it was fun. It's always a mixture of good and bad. But if it wasn't fun, I wouldn't have joined, so. Thank you.
Thank you so much. Thank you so much, Phoebe. One of the things that I really admired with you was how I think you probably weighed less than either of your lambs. And the way that you handled those lambs, you were like a wrestler. It was really impressive, I have to say. And it was really fun getting to know you through the auction as well.
Thank you.
Yeah, you're welcome. So our third presenter is the Ferrario family. So we have Teresa Ferrario and Domenico and their mom, Julie, with us this evening. So take it away if you don't mind. Next slide, please.
Next slide. Okay, so I'm Domenico Ferrario, and I go to high school at James Logan, where I'm in the marching band and play water polo.
I'm Teresa Ferrario, and I go to Cesar Chavez Middle School, where I'm in the school band.
And I'm the mom. Our oldest daughter, who you purchased her lamb, Amelia, is in a water polo game at the moment, and going up against some other competitors who we also see at sometimes at the fair. So yeah, go ahead to the next slide.
So a lot of the 4-H members, like 4-H and livestock is just one of the many things we do. Like a lot of people who do livestock are already like the busiest people. There's a lot of sports players because livestock can get very like physical when it's like super hot out and you have to handle your animals that like weigh a ton more than you. Like the pigs are 250 pounds and the steers are over 1,000. So yeah, that can get hairy sometimes. We see when they're trying to teach others. But yeah, people do a ton of stuff. Yeah, next slide.
In Bayside 4-H, we raise lambs and goats, and we have a special use agreement with Ardenwood Historic Farm, where we use the pen space to raise our animals, and we're really lucky to have that agreement.
Obviously, in this area, you all realize that most of us cannot just have a lamb or a goat in our own backyard. So we feel very fortunate to have that relationship with the Ardenwood Farm. Next slide.
Okay, so we get our animals for our family. It's typically in January. During December, we go out to different breeders we know, and in January we go to auctions, livestock auctions, to actually purchase some of our animals that we know are going to be at the auctions, and we want to see the different quality produced by many different breeders and see like what different genetics are out there and what we can do. And we take them to Ardenwood, and throughout July we work with them. We go to different clinics and shows, and yeah, we raise them at Ardenwood. We do a lot of like every night we go there at 4 o'clock, and we work them, we walk them, we feed them, and then like every day from January to July. Next slide.
We learn many skills in 4-H, including how to like watch out if our animals are sick, and life skills like management, patient, goal setting, budgeting. We also like teach the public about our animals and how it's important to like know where the meat came from instead of just being on platters at the store.
Yeah. One of the most important things at the farm is we see families that are like trying to feed our livestock animals like little weeds they find in cracks and dry leaves that fell from trees. And we have to explain to them like these animals are athletes. Like we're trying to raise them to be the most athletic looking, have the most muscle to produce the most meat and get judged at fair. And normally it's very eye-opening to them because they never like think that that is something people do, or that like these animals are like actually like used for something other than petting. Next slide, please. Okay, so when we go to a fair, we show our animals, and for the past couple years, Bayside 4-H has been doing pretty good at the fair. We've had a couple breed champions and reserves for the past couple years, and our older sister Amelia has been very successful in the showmanship aspect. She won 3 years ago. She won junior master showmanship, which is she won sheep and goat showmanship. But you only need to win one, and then you go into a series of shows where you show every species. So sheep, goats, pigs, steers, and horses. And they would bring in dairy goats and dairy cows if they were available. And you get a score on each one, and whoever has the highest score wins. And Amelia won for junior, and then the next year she moved up to the senior division and won senior 4-H. And then this past fair she was in it again but did not win. But yeah, it's been very good for our program to have really good showmen. Next slide, please.
So each fair we would like to make a profit for our animals because of all the money we spend. And at the fair, you're allowed to sell 2 large animals. And every year we try our best to make a good quality animal with all the meat and hope it makes fair weight and then sell it for a profit.
I want to say, just from my own personal background, coming from, I grew up in the Central Valley and I would go to the Merced Fair. I never showed animals, but I never knew anyone quite the same way as Chris Henry, who would actually create appointments and come out and talk to the kids. I think that's been so wonderful for these kids, because they learn to, have, maybe a 5-minute soundbite. Here's what I've done with my animal. Here's my expenses. Maybe I had to take my animal to the vet this year. It had a problem and I needed to buy some extra medicine. So a little bit more expensive this year than it was last year. But here's my break even. And here's what I'm hoping for, maybe make a little bit of a profit on top of that. Everything that these kids make, they put back into purchasing something the next year. And they're trying to save some so that when they go off to college, they have a little bit of a nest egg. So we really appreciate Washington Hospital, what you do for the kids out there, and just coming and being supportive of all these kids who put in just a tremendous amount of time and effort into learning about animals and raising them and finding out where does meat come from. It doesn't just show up in the grocery store on a little tray. So thank you very much. And I think we have one more slide. Just there you go. Pictures worth 1,000 words.
Family. Oh, very good.
Well, thank you, Julie and Teresa and Domenico. It's great to see you. And I learned so much from taking part in this year and learning from Chris. And I really hope this is a tradition that we can carry on, because you meet some of the nicest young people you can hope to meet anywhere, and their dedication to these animals is really unparalleled. Just in wrapping up, all I want to say is I just want to thank the board for continuing to invest in this activity and in the youth of the district by supporting the program. It casts a wide net the groundwork's been laid by Chris Henry, and I hope to carry that on. We have a long tradition of agriculture, and even in the Tri-City area here. And I think just it contributes to the health of the residents to continue to have these animals here at Ardenwood. And I hope we continue this for a long time to come. We're happy to answer any questions. Well, the kids can answer questions. I'm happy to try.
Are there any questions from the board?
Yeah.
Just thank you, Angus, and all you young people. What a wonderful, wonderful presentation. It's one of my favorite parts of the year, is to see the young people reporting on what they've done and showing the animals they've raised. And it gives you a really great appreciation for the goodness of the community around us, the goodness of the kids, and what they can do. I'm impressed that you know the difference between profit and loss. I'm impressed that you raise such healthy, big animals. That's makes me want to come over to the hospital and have some meat. But again, we truly appreciate what you've done. We're impressed with all the efforts you've put in to come here tonight, but more impressed with all the months you've put in raising an animal and getting that animal ready to show and presenting tonight. Thank you. Thank you very much for all you've done.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you.
Always an impressive bunch of kids.
Yeah.
Just really,
Hardworking.
really an impressive bunch of kids.
Yes.
Okay, we're ready to move on to our construction update from Ed Fayan, the Executive Vice President and Chief Operating Officer. Ed, I think you need no introduction.
Yeah.
You've been with us for We've been all together for many, many years, and we appreciate you being here tonight to give us an update on construction.
Okay, thank you, Dr. Stewart. So I'm here to talk about the patient bridge. We've given you an update as we're going along. We're well into this project now. To just remind you all and the public, this is really the first part of the projects that we're completing with GEO bond money that was approved by the voters. We have several that are on the docket. This was the first one, and it's tying together two of our seismically compliant buildings that are part of the master plan. And so this is we're better than halfway through, and we're making good progress, and we're staying pretty well on schedule, and we still have no major hiccups that are going to affect the budget at this point in time. Okay, next slide, please. This is where I basically left you all off last time, which is we got the two spans of steel across the loading dock driveway. And then we made progress on this since you've seen it last time. Next slide, please. Okay, this is the beginning. These two pictures give you a look at the cab section of the bridge. This is the section that's going to be tied into the Morris Hyman Pavilion, and it's a section that has to move. So you can see in here the cab starting to be built from the bridge portion over to the building. Next slide, please. It's a little bit harder to see here, but there is work that's going on with steel coming out from the Morris Hyman Pavilion to join up with the cab, and the part at the building will have to move around the bridge. And so this is in the process of being done now. Next slide, please. This is something called the intumescent painting of the underside of the bridge, and this is done for basically rust protection. This was something that was added on in this project due to some concern about the long-term preservation of the underside of the bridge. So this was added in this project. I think it was a good move. Next slide, please. Here you can see the beginning of the metal decking going on in preparation for concrete to be put onto the bridge. Next slide, please. And here you can see the beginning of the preparation. You can see rebar down into onto the flooring, and then you can see in this picture, the bottom picture on the bottom right-hand side, they're starting to pour the concrete. Next slide, please. This picture doesn't show you any other step in the project. It just shows you that at one time we were putting down rebar, we were doing the intumescent painting, and they were starting to work on the drywall studs. Next slide, please. This gives you a look at what the finished concrete deck looks like that will be the final substrate of the flooring that will be the bridge. Next slide, please. This is just showing you that there's penetrations in the beams, that they're putting in fire sprinklers underneath that will that are part of the required fire control system on the underside of the bridge. Next slide, please. Okay, here you can see that they're starting to form the clips for the exterior metal framing, and you can get a better idea of what's going on here at the next slide. And they're starting in the next slide to hang the drywall support and the exterior infrastructure that's going to hold the metal skin that'll be the final portion of the project to complete. Okay, so that's the end of the progress photos of the bridge project. I wanted to move on to the CJR garden level offices. I need to preface my comments by saying this is not a GO bond project. This is something that's being funded by the hospital, and this is an expansion of the physician offices. You know that we've had basically now doubled the number of physicians that are working in the CJR or the IJR, and this is adding clinic space in the what we call the garden level of the CJR building. So just quickly, I wanted to show you because this project needs to get completed because of the growth that we've had, and then also to clear out our use of the old Fremont Clinic over at the 2500 building, which we need to move forward with for the cancer center to renovate that space, which is just recently been approved by the city of Fremont and the HCI offices. Okay, next slide, please. So this just gives you a look at one side of the garden level of the CJR. You're looking in the first photo down towards the physician offices, and this is also workspace for some of the staff that will be working there, particularly the scheduling and back office staff. On the right, that's one of the physician offices. Next slide, please. Here you can see the other physician office. There is going to be X-ray on this in this office, and we've tried as much as possible to make it a carbon copy of the offices that are on the second floor of the CJR. It's not possible to make it a carbon copy, but we've tried to. It's approximately the same square feet, and we're putting in the same capabilities in this clinic as we have upstairs. Next slide, please. This just is showing you some of the progress in the workspaces. This is outside on the left, outside of the X-ray area, and this is in the staff or PA work area, the work going in overhead. Next slide, please. This is the physician and PA work area at the end of the office space, where we have exam rooms all laid out in front of these. And then this is the reception space off of the garden level entry into the building. Next slide, please. Okay, so that's it. We've started that project this summer, and so we're making good progress. We hope to have it completed by latest January, maybe December of this year. And you know, it's going along well. So I just thought you might be interested to see. That's kind of a linchpin in some of the other things we have going on here, particularly the cancer center. We need to get this done so we can start cancer. Okay. That's all I have. Any questions?
Thank you very much, Ed.
Wait, well, I have just one thing I gotta ask Ed. Ed, you really watch this thing? I don't know
yes.
I don't know what you think.
Are you asking?
It was in a waste paper basket. I dug it out.
Are you asking to buy that from me, Mike? Is that what you're asking there?
Well, okay, yeah. Oh, yeah. Okay, well, I hope you guys beat. I don't care who beats FC. You know, so I just hope you can do something this weekend. Okay.
I don't make any promises.
Yeah.
Ed, I need to apologize for that. That was not on the agenda.
Recorded meeting.
Ed, it's always good to hear from you. Thank you for the update.
Yeah,
Hopefully that garden project will be done December, huh?
Yes. So we can keep rolling with the other things that we have on the docket.
Exactly,
Yes, yes.
exactly. Anyway,
Domino.
thank you very much. It's also kind of fun to see that bridge coming
Yeah.
together. I had no idea it was gonna have a cement floor in it.
Oh, yeah.
Substantial thing.
Yes, yes.
I think I'll head there in an earthquake.
No.
Anyway, thank you, Ed.
Thank you.
We're ready now to move on to some of our reports. Our first report will be from Dr. Mark Soleil, our Chief of the Medical Staff. Welcome, Dr. Soleil. It's good to have you here. I think you're muted.
Well, thank you, and it's good to be here, and good evening. Thank you for letting me know. I would have talked on forever. All right, I'll jump right into it. So we'll start off with the hospital census. We have, for the medical staff, a grand total of 608 medical staff, of which 340 are active. For the core measures, the only thing that stood out that's worth reporting from the August is the C-section rate. That's the core PC2A, as it's known. That's the only one that was out of range. Out of 55 patients that we had for that month, 18 had a C-section. That's a rate of 32.7%, whereas the Joint Commission national benchmark is 23.9%. So that's definitely higher. Going back for the previous 12 months, out of 180, we had 183 C-sections, and that's a rate of 26.9%, much closer to the benchmark of 23.9%. So that's just 1 month. That's a bit of an anomaly, and hopefully it'll even out with more time. The QSC committee is aware of that, is on top of it, and trying to bring that rate down. The next thing I'd want to update you on is aquablation. We started that 2 weeks ago. I did 5 cases. I did 3 more this morning, and they all went well. Dr. Shu is doing some cases in a week or two, and I know that Dr. Sankavalli, Dr. Shingal, and Dr. Kim have all applied for the privilege, and hopefully we'll be doing cases soon too. So the program is up and running, and we'll keep getting busy. The next thing is the Tiger Connect text messaging system is being tested and being phased in right now. This is the secure HIPAA compliant texting that we would like the medical staff to use for communicating. Right now, everybody's using their own cell phones and using regular text messages where we have to be very sort of covert in the information and using medical record numbers and initials and patient location because to be HIPAA compliant and protect patient information. The Tiger Connect is going to be very versatile. We can actually use the full information, including pictures, images, and it is secure. Right now, it's being rolled out to select few doctors, including the medical staff leadership. I just got mine activated. I haven't had a chance to use it other than a test, one test message with Dr. Smith. But hopefully, we're going to expand that very quickly and work out all the kinks. I think you guys are aware that the mask mandate is coming back, I believe, as of November 1st for the hospital. Top Hat is coming up. That's next weekend, and hope to see everybody there. And I believe that is it for my report. Any questions?
Don't seem to have any questions for you, Dr. Soleil. Thank you very much for your report. Very, very nice to know the progress we're making.
You're very welcome. My pleasure.
I'm kind of interested in that secure messaging system. That's very nice.
Yeah, I think it's going to be very helpful.
Yeah. And just an update on the masking. As we know, Alameda County has mandated masking in direct patient care areas. So as of November 1st, in terms of inpatient direct patient care units, there will be, for the staff and providers, masking requirements.
Okay.
For that. And highly recommended for those who are visiting. Yeah.
Thank you.
Yes.
Thank you.
Thank you.
Again, thank you very much. Good to have you with us.
See you Saturday.
Thank you very much. Have a good evening.
Yep. We're ready now for our lean report. Kimberly, if you could introduce that for us.
Yes, we are going to have a presentation on the Washington Hospital Women's Center. And we have two presenters this evening. The first is James Farr. He's the Director of Medical Imaging Services, and he is responsible for both the inpatient and outpatient imaging modalities. He has been with Washington for 3 years. He was previously at Samaritan Hospital in New York, where he was the Director of Diagnostic Imaging Services for the hospital system, including interventional radiology. He received his undergraduate degrees in biology and chemistry from the University of Hawaii, a degree in nuclear medicine from the University of Vermont, and his master's in healthcare administration from Western State University in Wichita Falls, Texas. Current certifications include ARRT, CNMBT, and Greenbelt Six Sigma. Our second presenter is Christine Mickelson. She is our breast health navigator at the Women's Center. She is responsible for guiding patients and their family through the breast cancer journey. Patient navigation helps guide patients through and around barriers in the complex cancer care system to help ensure timely diagnosis, treatment, and support. Her support for her patients started at the Women's Center by guiding them through the process of diagnostic mammograms and breast biopsies. Additionally, Christine is involved with educating our community about breast health through outreach events, including Washington Hospital's annual Celebration of Life and Think Pink event. She has been at Washington Hospital for 7 years, and previously she was a bedside nurse on the telemetry unit at Washington Hospital prior to this new role in the Women's Center, where she's been for 2 years. She received her bachelor's in nursing from the California State University, East Bay, and received her breast health clinical navigator certification through a Magnet accredited program. And I just want to say that Christine has played an integral role in this program and I've seen many of the wonderful community responses that she has received in terms of the work she has done, and she truly embodies the patient first ethic and heard it from many patients directly. So my pleasure to introduce both James and Christine.
Thank you so much for the introduction, Kimberly. I'm Christine. I'm the nurse navigator at the Women's Center, and I'm so excited to share with you our presentation. If it's okay, can I go ahead and share from my end?
Yes, go ahead.
Sure, please go ahead.
Thank you. James, would you like to introduce yourself?
Yeah, we're going to work together on this presentation, so I'll be coming in a few slides, and we hope you'll like how we do this.
All right, so tonight we're going to go over our improvement initiatives and community outreach that we've been doing here at the Women's Center. Thank you so much for having us this evening. Thank you for the board for your time. And I'm just going to move over. There we go. So we're going to start about, tonight we're going to talk about the Washington Hospital Women's Center. We are an accredited College of Radiology Breast Cancer Center of Excellence. The designation includes our mammography department, our interventional procedures, and our ultrasound department, which are all ACR accredited. Together, they have contributed to Washington Hospital attaining the highest standards that being a breast center of excellence represents. Today, we would like to share with you how we reached this designation. We will talk about the efforts and actions that were taken to establish a healthcare center to be proud of, and what we're doing to maintain our quality of care. We will share some of the metrics that we use to measure our success. And lastly, we will showcase the Women's Center involvement in the community and how we represent our organization to the patient population. First, I would like to introduce you to the team. Change and areas for improvement at the Women's Center start with our staff that work hard to care for our patients. Through their interactions and patients in our system, new ideas are brought forward to better improve our patient care and our current workflow. It's a team effort to be sure. However, it's a very strong team that makes and maintains the quality of our services. Here, our team consists of radiologists, nurse navigators like myself, imaging technologists, clerical staff, imaging managers, registration, and scheduling staff. So how do we communicate with each other? How does a large team talk to each other? Well, we have communication tools in place, and I would like to share those with you. We have these tools in place to allow for communication to flow through our center and between the different departments that make up the Women's Center. One of the tools in place that is used to gather good ideas and to identify areas of concern is our lean board, which is a picture of a lean board is the top picture on the slide. Oh, pardon me, I'm just going to go right back. One of the tools in place that is used to gather good ideas is our lean board. So our lean board allows for a central location for the exchange of information, pertinent information to our daily activities. It contains quality measurements, action items, measurements of progress, and vital information, not the least of which is our patient compliments and complaints and the ability to acknowledge our staff for their great work. So all our information that's pertinent is there for the staff to see. In addition, daily morning huddle conference calls where we review our daily readiness and address any issues in real time, such as patient issues or concerns, staffing issues, equipment and supply issues, were initiated. Weekly all staff, I do apologize. Weekly all-staff huddle calls are conducted as well. It was an adaptation of the lean huddle to enhance participation by allowing staff from all departments to join virtually. So we do a virtual call that's almost like a lean board each week with the staff. And during that time, I will take pictures of the lean board to help initiate the communication and make sure everyone's on the same page. So what challenges have we tackled at the Women's Center? Well, in the spirit of Kaizen, meaning to change for the better, the Women's Center strives for continuous improvement in the quality of healthcare it provides. Collaborative efforts were undertaken with the Women's Center, including the team, which includes the registration staff, our IT support, our technologists, our physicians, our administrative staff, and logistical support staff. This collective knowledge and experience of these resources were utilized to define and focus on the areas of concerns. We're now going to go into those challenges we have faced. This list here on this slide includes some of the challenges that our team actively worked on in order to create positive changes. The first one is scheduling. Scheduling mammograms can be complex because a patient's age, prior history of breast cancer, breast symptoms, and even their gender all factor in on how we create an appointment. It's crucial to have complete and accurate information to ensure the right order, the appointment priority, and that the correct imaging procedure are performed. Our registration staff is notified. Our registration staff works closely with us, and they had notified the team that patients were asking for Saturday mammograms. Our usual business hours are Monday through Friday, 7:15 a.m. to 4 p.m. To better serve our community, we knew we had to expand our services to include Saturday hours. The next challenge was our time between patient screenings. Follow-up diagnostic exams and subsequent biopsies can contribute to a patient's fear if it's not done in a timely manner. Patients face the fear of a possible breast cancer diagnosis while they're waiting for their next appointment. Therefore, the challenge of reducing the wait time between these procedures plays a significant role in the reduction of anxiety and the promotion of a positive patient experience. We are very sensitive to the stress the patient experiences while waiting to know their status. Changes in the radiologist workflow present challenges to the goal of expediting the scheduling of these exams. Lastly, while working with our patients and doing outreach in the community, the feedback received indicated that our community is unfortunately unaware about the range of services provided at and through our facility. As an example, we at the Women's Center are proud to say that we are accredited by the National Accreditation Program for Breast Cancers, also known as NAPBC accreditation. It demonstrates the commitment to providing the best possible care to patients with breast cancer. The rigorous performance evaluation from NAPBC and the compliance of its standards is a very prestigious title, but there seemed to be a lack of awareness in the community of the high quality healthcare resources the Women's Center represents. So to tackle the first problem, we wanted to make sure we were able to expand our mammogram appointments. At the onset of our action planning, scheduling errors were a concern for the Women's Center. So before we could even expand our appointments, we had to address our issues with our current workflow. The frequency of about 4 to 5 errors a week would cause delays in patient appointments, delays in the check-in process at registration, and ultimately cause the imaging appointments to fall behind as the errors were required to be fixed in real time. This domino effect led to a decrease in productivity and increased frustration for all. Scheduling errors were subjected to a root cause analysis by the imaging team. The lack of knowledge ordering diagnostic mammograms was recognized as a key significant source of error. So in collaboration with the supervisor for central registration, our radiologist, and myself, a mammogram scheduling tip sheet for the registration staff was created, as you see here on the slide. This guidance sheet is based on key patient information that is required to be known prior to scheduling, such as, such as a patient's age, their gender, and their previous breast history. This one-page tip sheet was given to physician offices to assist their teams with putting in the right order for their patient. This immediately reduced the errors received by registration to approximately just 1 a week, which was a dramatic decrease. With the use of this tip sheet, even our registration staff could now easily verify the oncoming orders if they were correct or not prior to scheduling the patient, and then in turn could help the patient get the right order if needed. I also make a radiologist schedule 3 days in advance and send it out to them now that they are remote. This sending out of the schedule has greatly reduced the number of errors because the procedures are now reviewed ahead of time by the radiologists themselves. And if there's any errors with the scheduling or if prior images are needed, we can address it early before the patient even comes through our center. Additionally, as the nurse navigator, I manage the schedule and I put in blocks within the schedule to make sure that appointments are done in a timely manner. These blocks are also applied to breast biopsies, using the experience of both the nurse navigator and the registration staff that the need for additional appointments are anticipated and planned for. With only one radiologist on campus, we have to carefully utilize the radiologist schedule. In making the transition of the radiologist schedule to a universal format in Epic, all appointments are now tied to the required radiologist, thus preventing overlapping appointments or double booking the radiologist resource. In summary, continuous collaboration with the radiologist, the technologists, and referral offices, along with an improved scheduling strategy, had a major positive impact on our workflow and patient throughput. The challenges regarding the availability and access to our healthcare services set the following plans into action by getting additional mammogram appointments available, addressing the need for having more flexible hours for our community to schedule mammograms. Throughout the month of October through December, we have now open Saturday mammogram appointments from 7:45 a.m. to noon. Our goal was to not only provide the extra hours at a convenient time, but to be aware of the staffing needs according to the demand and adjusting as needed. For example, Saturdays remain open from October 2022 until August 2023. By monitoring the appointment schedule on a weekly basis, the Saturday mammogram schedule remained open as demand continued. Additionally, as you see here, that's our flyer in the middle, and to the left is our mammogram tech with our machine. And this flyer was established and promoted throughout our community to help raise awareness about our additional hours. All right, James.
Hi, May 1st, 2023, our second 3D mammography machine was brought into our department. The additional mammography scanner effectively doubled the capacity of mammograms and interventional procedures for the Women's Center. On the left is an example of the newly installed scanner. On the right, you can see that we have both scanners in close proximity and operating simultaneously. In addition, the ability to perform a biopsy procedure can utilize either room. Thus, the scheduling of procedures is greatly enhanced, and there is a backup capability should one scanner be unavailable. Having two scanners allows for the delineation of the workflow and results in a more efficient operation for both imaging and the procedures we perform. Faster scans can be in one room while the other one can handle more lengthy exams or procedures. And prior to the arrival of the second scanner, the wait time to get a patient in for a simple screening mammogram was on average about 4 days. The Women's Center can now offer a same-day appointment and more time slots convenient to when the patient population is requesting. This greater capacity has also had a positive impact on the wait time for patients to get a diagnostic exam, and we'll demonstrate that in an upcoming slide. But first, let's look at another notable expansion of our services. This is our new bone density room. On the topic of utilization and enhanced services, we'd like to mention the new bone density area at the Women's Center. This is a 224 square foot room that was renovated and repurposed with the new bone density scanner located there. The scanner comes with updated software that can provide a wider range of body analysis. The room provides greater access to our patients with wheelchairs, walkers, or for those that might need some assistance. The room provides an enhanced area for our FibroScans, and the room allows for the use of a radiation shield for the operator. So this is a great example of the expansion of the services and the improvement in the patient experience. But getting down to some more of the measurements we took to back up these changes, our efforts were made through the actions previously described, greatly increased the efficiency and the access to the services that we offered. Following a continuous improvement program, the next step is to check the fruit of our labor and analyze the data regarding patient throughput. This is a measurement of our success with the changes the team implemented. This slide represents the time it takes to get from a screening mammogram to a follow-up diagnostic mammogram. Basically, if there's a finding that requires our patients to return for more imaging, how long does it take to get back for that diagnostic exam? Well, the results show that in comparison to the national average of 12 days for a patient to get their follow-up diagnostic exam, our Women's Center is averaging 7.6 days year-to-date, calculated up to July. So the turnaround times are trending towards shorter and shorter wait times to get appointments. The install date of the second scanner is shown on this graph, and it coincides with a positive trend. The addition of the new mammography machine has allowed for more diagnostic testing to be done in a single day. So the goal that the Women's Center seeks is to achieve a 5-day turnaround time, and so far we're on a trend that is favorable on reaching that goal this year. This is a slide showing the data when we went to measure the turnaround times between a diagnostic image and to get a follow-up biopsy. And for any patient that has had a diagnostic exam where a biopsy has been recommended, the stress and anxiety waiting to have that procedure performed increases the longer it takes to get that appointment. The results of the biopsy are going to determine the pathway of care going forward. Therefore, it is imperative to us to keep that time between a diagnostic mammogram and the recommended biopsy as short as possible. So this graph represents that time between diagnostic exams and the biopsy appointment here at our Women's Center. Now, the national average turnaround time for this measure is approximately 9 days. This has been the goal for our department. Year to date through July, that average turnaround time for our Women's Center is 9.6 days. Close, but a little bit over. The months of June and July, however, showed 7 and 8 days respectively. So improving our wait time for biopsies is an objective we monitor closely and are constantly striving to improve. Although we are not consistently at our goal, we were able to address the challenge of having only one radiologist on campus to do the breast biopsies while still making improvements with the wait time. So we hope to maintain a positive trend that has been established over the last documented months.
And to wrap up this presentation, so we have really worked out our workflow here at the Women's Center to achieve those goals that James just went over. But our last challenge was just outreach and raising awareness about the amazing services we provide here. So with all the strong work performed and the many improvements made, we are excited to tell the community about it as well. Every year, we have 2 cancer events that I help organize. In May, we have our Celebration of Life event. The flyer is at the top. It's a gathering intended to inspire and educate everyone touched by cancer. It's a free event to the community, open to anyone. And this year we had 70 attendees. Every October during Breast Cancer Awareness Month, we hold our annual Think Pink event. It's an evening to raise awareness about breast cancer, but also to educate and support our breast cancer survivors. We are expecting 250 to 300 guests. I also attend our family health fair in July and the HERS Walk On fundraiser in September in order to represent the Women's Center and to notify the public of the great services right here in our community. At these events, I also introduce multiple services that we have not only here, but through our breast cancer program. I found it a great way to connect with the community and share our resources. Additionally, there's been a change with the breast cancer support group that I run. I have transitioned it to a hybrid format, meaning in person and online starting this June of 2023 to allow that those that are unable or uncomfortable to be in person to also attend virtually. And it's been a great success with my support group. Lastly, October is Breast Cancer Awareness Month, and it's a great time to raise awareness about our resources. In order to better connect with the community, we have collected words of hope from our WHHS breast cancer survivors and our Women's Center staff. These words were then designed into a heart logo that you see on the top left corner and on that t-shirt there. This logo will also be the central theme for the month of October and will be utilized in our flyers, posters, and social media posts. You might be seeing some of them in our Tri-City Voice articles. It will also be displayed throughout our Think Pink event. You may see this word of hope emblazoned on this year's Breast Cancer Awareness pink t-shirt, like the one I'm wearing here this evening, that our staff is proudly wearing during the month of October. Pardon me. Sorry, technology. And in addition, I believe that seeing these words of hope from local breast cancer survivors helps show our community that we really care for our patients and their well-being. We have established a tradition of also giving out a pink rose, a fresh pink rose every month during the month of October for any woman getting a mammogram here at the Women's Center. This simple gesture has been very well received by our patients, and again, it represents the efforts of the organization to reach out to patients we serve and let them know that we appreciate them. We want to send the message that we are here to instill hope and raise awareness to those that may be facing a diagnosis of breast cancer. Thank you all so much for your time this evening. If you have any questions, feel free to ask, but I hope we were able to showcase all the great things we've been doing here at the Women's Center, and it was an honor to present in October during Breast Cancer Awareness Month. Thank you.
Good job.
Thank you to both of you. Very, very informative, wonderful presentation, wonderful hope for our community and all that you're doing. It's very, very exciting. Thank you.
Thank you.
It's hard for you to see probably, but I have a pink tie on tonight.
Excellent. Well, thank you so much.
All right.
I have a comment and a question. The comment is, I think it's delightful and superb that we're able to offer same-day appointments for women seeking mammograms. That's a real step forward. So here's the challenge. Is it possible to go from screening to biopsy same day? Is that conceivable? Is that feasible?
It's more likely that you would want to have a diagnostic exam and then go to the biopsy. So I will just rephrase what you said and say, is it possible to go for a diagnostic and then hold a patient in a sub-waiting room and ask them, we have the capability to do this. Can you stay? Would you like to do that? That is a possibility for us. And there are very, very few places that I'm aware of that could perform that at that high level, but it's not an impossibility. It just takes a fair amount of support to reach that goal.
But I can say that this month we scheduled 2 breast biopsies the next day after their diagnostic imaging through the great support of our physicians here and our team.
That's beautiful. Makes a huge difference for those women who are waiting and worrying.
Absolutely. Yeah. And it's something we will continue to improve.
Thank you.
Thank you.
Again, thank you very much. Very encouraging, exciting report. We appreciate all you're doing.
Thank you.
We're ready now to move on to our Service League report with Sheila Vijay. Welcome, Sheila. It's good to see you again.
Thank you, Dr. Stewart. Good evening, district board members. I don't know how I can match my presentation to what the Angus and the kids did, but I will try my best. Warm greetings on behalf of all our volunteers. In keeping with our time-honored commitment, 193 volunteers collectively contributed 1,805 hours in the month of September. We also hosted an orientation on Saturday, September 30th, which was attended by 15 high school students, 15 college students, and 12 adults. Last month in my previous report, I highlighted the Cuddler volunteer program. This month, I'm pleased to draw your attention to our Nurse Unit Assist volunteer program. This program is specifically crafted to help the nurses during busy times of the day by providing support and companionship to patients, answering call lights, restocking supplies, and liaising between the clinical staff and the patients. The volunteers must complete at least 4 3-hour training programs, which cover effective interpersonal skills, confidentiality policies, attentive listening, and the importance of maintaining a sincere, caring demeanor at all times. They also undergo rigorous training in operating the Staxi wheelchair for patient discharges. I recently spoke to one of our trainers, Brian Wang, about his experience, and he says, volunteering with Washington Hospital Service League has been transformative. During my time here, I've had the honor of volunteering with incredibly dedicated and kind-hearted individuals. The commitment of longtime volunteers in the league reassures me that I am in the right place, surrounded by people motivated by selfless service. My journey as a volunteer was a departure from my previous career as a chemist. I sought a path aligned with my evolving values. Volunteering my time to make a meaningful impact on others felt like the natural choice. Recently, I've been honored to train new Nurse Unit Assist volunteers. My goal is to instill the same dedication and professionalism in these new volunteers that I've had the privilege of experiencing myself. Our NUA program, which is a Nurse Unit Assist program, currently has 133 active volunteers serving the main hospital, Morris Hyman Critical Care Pavilion, and the emergency department. Based on my experience talking with volunteer leaders around California at the annual convention for hospital volunteers, I can tell you that this program is unique in its nature. Not only does the NUA program support our nurses, it also prepares the next generation of young medical students and professionals to contribute in a compassionate healthcare environment. The board of the Service League is very proud to support this groundbreaking program. And that is the end of my presentation. Please let me know if you have any questions.
Thank you very much, Sheila. Are there any questions from the board?
I have a question in terms of age. What would you say is the average age of the NUA volunteers?
They are about 18 years old. They have to be an adult. They cannot be in high school.
Mm-hmm. But do you feel like you have more college than you have adult, or is it kind of even?
We do have more college than adults, but for example, at the last orientation, we had 12 adults. So we are trying to branch out and talk more about volunteering at the hospital. For example, I was at the Acacia Creek this past weekend. Evangeline, our director of volunteer services, was at another place yesterday at the city of Fremont. So we are hoping that by spreading the word, we will be able to interest more adults into our program as well. But we have to keep in mind that many of our students are also local students. So they are here for quite a bit, quite a goodly length of time. And they do want to gain the experience and the knowledge that they can from all these volunteering experiences. So we do have a great group of volunteers.
Thank you.
Thank
you. Thank you, Sheila.
Thank you.
Appreciate all the volunteers do. It's a very, very important part of the hospital.
Thank you.
Ready now to move on to our quality report. Kimberly, if you could introduce that for us.
Sure. This evening, we have Dr. James McGuire. He's the medical director of the Special Care Nursery, and he is going to give the annual report. I'll just introduce him. As you know, he's the medical director of the Special Care Nursery at Washington, where he practices neonatology. He is also a professor of pediatrics at the University of California, San Francisco, and he practices and teaches at the UCSF Benioff Children's Hospital, San Francisco. He received his undergraduate degree from Harvard, his medical degree from the University of California, San Diego, and a master in public health degree from UCLA, where he also completed a residency in pediatrics and a fellowship in neonatology. His work interests include team harmony and collaboration. James is fond of the Bay Area, having grown up here, and currently lives in Fremont with his wife and 2 children. Thank you for joining us, Dr. McGuire.
Thank you for having me. It's always a pleasure to be here. And yeah, thank you, Dr. Stewart, Dr. Nicholson, Michael Wallace, Dr. Reapin, and Jeannie, and of course, Kimberly Hartz and Cheryl and others. So yeah, I think they're going to be slides. I think Shri is going to run them.
Yeah, Shri will put them up right now.
Very good. Well, he's getting them going. I just want to second what was said about the Service League. They are hugely important for the Special Care Nursery. Was made mention of the cuddlers, and they really help in terms of our care of the babies, and so really very, very valuable what they do, all obviously across the hospital, but in the special care unit in particular. I'm aware of that. Okay, so yeah, so this is the Washington Hospital Special Care Nursery Report, and again, I'm the professor of pediatrics and the medical director. Next slide, please. Our background is Washington Hospital, specifically Special Care Nursery, established a partnership with UCSF in March of 2014. So we're coming up on 10 years of being affiliated with UCSF in Washington. The physicians collaborate and work alongside the Washington Hospital nursing and ancillary staff. And I can't emphasize that enough about how much collaboration and team harmony there has to be to have the outcomes that you'll hear about, because there's a lot of working with physicians, to OBs, and to pediatric hospitalists, to the nurses, respiratory therapists, and so forth. Services include stabilization of the newborn, respiratory support, including ventilatory support until we transfer them if they still need to be on the ventilator, initiation of therapeutic hypothermia, intravenous fluids and medications, nasogastric feedings, incubators, warmers, and cardiorespiratory monitoring. I really want to give a shout out to our new staff. We have Shannon Tibaldi, who is the Special Care Nursery and actually pediatrics nurse educator who joined Washington Hospital this summer. And we have a very strong support team. Next slide, please. So Special Care Nursery census, let's just look at our data for the last few years. And you can see that the sort of gold is in the is in for 2022, and then blue is for 2021, and then gray is for 2020. And so the births have stayed about the same, and the admissions sort of vary, and then the patient days also vary. But in the last year, our census has been a little more increased from previous years. So we're about 3.2 in 2022. And then the prior year was 2.6, and then the prior year was 3.2. So it sort of bounces around, but that's sort of where we've been hanging out the last few years. Next slide, please. Because we're a level 2 unit currently, then we have to transfer out patients that we can't provide good care for at Washington Hospital. That typically means our patients who, for example, are extremely premature, need to stay on a ventilator, need therapeutic hypothermia, or need surgery or other things that we can't provide at Washington Hospital. So in 20, again, the gold is the 2021, and then the blue is 2022. And so it looks like we went down a little bit on our transports out and from 2021 to 2022, and that just sort of varies from year to year depending on what kinds of babies are born. And then in terms of the transports into the special care nursery, we get babies back from when they, if possible, if we can take care of them when they're more stable. So for example, the extremely premature babies that were born at Washington, and need to go elsewhere, we then try to get them to come back, which is better for the families. And so they often, like moms, will be able to breastfeed better if they don't have to travel up to either Oakland or San Francisco, or go to Stanford to work on taking care of their babies. So we're always trying to encourage those babies to come back to Washington Hospital and provide care here. We also get babies that come from the emergency department occasionally, or from the pediatric patient area if we feel like they're going to be best cared for in the special care nursery. Next slide. Quality metrics. So we have, as a level 2 nursery, some quality metrics we follow, and we're proud of what we have. And so there's antibiotic usage, central line associated bloodstream infections. We are an intensive care unit and have some central lines, and our focus on skin to skin in the last year. Next slide. So we participate with a California Perinatal Quality Care Collaborative, which was set up more than a quarter century ago. And this has been a database that many of the neonatal intensive care units in the state participate in. And then we can benchmark how we're doing against other neonatal intensive care units in this network. And so you can see for the antibiotic usage, we are the red star, and so we're sort of right in the middle. And then for the intermediate neonatal intensive care units, we're an intermediate or level 2 neonatal intensive care unit. We're right in the middle. It's a little unclear about whether it's better to be super low or super high or what, because that's really depending on the patient population and so forth. That said, it's probably better not to be, around the average or a little bit below based on the information we have now, because we don't want to use too many antibiotics unnecessarily. Next slide. And then our central line associated bloodstream infections, these are infections of central lines. We are very happy and that we've had 0 over the last 3 years. We put a lot of effort and time into making sure that we're doing everything we can to prevent those infections. And so we average about 40 or so central line days a year. And so, we are, or as you can see, we've had 0, and that's really great. Next slide, please. The other metric that we worked on to see if we could improve what we were doing, and it's something that there's other places out there that are doing it, but not a lot nationally, was we wanted to increase our skin-to-skin contact with babies and with their mother fairly early on in life. And the benefits of that are, as you might imagine, that helps with breastfeeding, it helps with bonding, and so we wanted to focus on that. And so in the summer of 2022, we decided to start gathering this data and included even the premature babies down to 35 weeks and 0 days. And our goal was to educate the team, nurses, pediatric hospitalists, neonatologists about the importance and the safety, if this is done well, of trying to get skin-to-skin contact as soon as we can, because sometimes we will send the premature babies quickly to the special care nursery, and we thought we could really do the skin-to-skin contact, and we are happy to say that we started off with just 68.9, which actually was pretty good. We did the training, that was in June 2022. We did training to the nurses and then had to obviously work with our EPIC Epic colleagues to start the documentation and data collection in a way that would work for extracting this information easily. Next slide. And within less than a year, we did achieve our goal of getting over 80% of the babies at 35 weeks and greater to do some skin to skin with the mother, and we're very happy about that. We feel like that's going to be something that other units and other places are going to be focusing more and more in particular. And then next slide. In particular, we were actually coincidentally, unbeknownst to us, the California Maternal Quality Care Collaborative was just starting to collect at the same time the data on the term infants that didn't go to the neonatal intensive care unit. So they had also felt this was important, and so it was sort of funny that this was something that was sort of being thought of in many arenas of how can we do more skin to skin time. So this wasn't something that we were working on for the hospital because this was the term infants, and as I said, but Washington, which is the red color, and then the California is the blue color, was already doing well, as you can see, for the term babies. And I think the reason why is Washington, because of it being a baby-friendly certified hospital, had been encouraging the skin-to-skin early to improve breastfeeding. And that's been well documented as helping with breastfeeding. So Washington was already doing it for the term babies. And as I said, we worked more on the premature babies also. Next slide. Other things that are going on in the special care nursery, and again, this is really what I'm saying, it applies to the entire second floor, because if we have a case study, then it's not just looked at for relevance to the special care nursery. We talk with the obstetricians, we talk with the labor and delivery nurses, and the special care nursery nurses and the pediatric hospitals. And so when we do case studies, we have a multidisciplinary team approach. UCSF provides support with outreach courses for the nursing staff on neonatal nursing care, and we have a skill lab for neonatal procedures that they were involved with, and also they also focused on stabilization for the critically ill neonate for transport. So it was very helpful for our nurses. We have neonatal UCSF faculty support, where we have a quality perinatal outreach program, and we do clinical care conferences, and we review topics that are of interest to the obstetricians in the community and the pediatric hospitalists and the neonatologists, and these are quarterly. And then we have an association of women's health, obstetric and neonatal nurses training, which the nursing leadership and nursing educators help coordinate. Next slide. Our next steps, we really hope to resume our annual SCN reunion celebration, which has been on hold now for several years. Obviously, that's pending COVID restrictions, and so I think in the slide one that has the most number of people, there might even be some of our cuddlers there. And this is another slide with our nurses and some of the doctors and nursing leadership, social worker. As I said, it really is a family that helps to take care of these babies and provide good care. And there I am also. And so we try to really make it a fun affair. So as I said, it's something that we're hoping to do. The other thing that was on the prior slide was we're also working on our strategic planning for our level 3 neonatal intensive care unit in the new hospital. And we'll have to figure out the plan, the design, and then of course we'll be taking care of sicker babies and more babies. And so there's a lot to figure out there. And can you skip to the end? I think that might be next slide, please. And next slide. I think we're done. Yeah. Any questions?
Any questions from the board? Great.
James, this is Dr. Eapen.
Yes.
Thanks. Yeah, great presentation. One of the things that I didn't see in the service provided, phototherapy was not mentioned. I'm sure you're giving phototherapy
Yes.
for all neonatal jaundice. which most community physicians or pediatricians are very thankful. But I
Yes.
think I didn't see that in the service provided list.
Yes, you're absolutely right. We do provide phototherapy and for a lot of our babies. It's actually been a little less because of the newer, as you know, the newer American Academy of Pediatric guidelines, which came out in the summer of 2022, are decreasing or making it less likely that we'll provide phototherapy. But it is as a very important part. And indeed, for the jaundice, our next outreach, which if you hope you can join, will be on isoimmunization. We had a baby that eventually needed an exchange transfusion, and so that will be our next discussion in November 13th, I think, the second Monday in November. So hope you can be there.
Thank you.
You're welcome.
Thank you, Dr. McGuire.
My
Really
pleasure.
appreciate your work. Really appreciate your work there. It's wonderful, wonderful progress.
Thank you so much. Have a great rest of you.
You too.
Thank you.
We're ready now for our finance report. Tom McDonald.
Thank you. I'll be reviewing the August 2023 monthly report. And when we started the budgeting process for our fiscal year 24, we were optimistic going into the new fiscal year. Even though the results in August are unfavorable to budget, they are better than July, and we continue to see the opportunities and strategic initiatives that we implemented as part of the budget, average length of stay initiative, the Charge Master update. We've been a little over a decade since the Charge Master was updated. The productivity, looking at our FTEs, and the cath lab is now up to speed. We had one doctor join us in September, and then the other doctor joined in earlier October. So we have replaced the two that we were missing from last year. You'll see that in the volumes. So it's more of a ramping up than an immediate day one, and we're starting to see that with August. Inpatient daily census for the month of August of 146 was off one from the budget of 147. Year to date is unfavorable by 4.2 on a budget of 153.3. The combined average daily census for the month of August of 158.3 is unfavorable to budget of 155.5, but year-to-date result was slightly favorable by 0.9 to the budget of 161.8. As a reminder, average daily census includes the outpatient observation equivalent days. Discharges of 877, slightly favorable to the budget of 870 by 7. But on a year-to-date basis, we remain unfavorable to budget by 88, or almost 5%. Patient days of 4526 were slightly unfavorable to budget by 30, and year-to-date, our patient days are off by 257. Both outpatient observation and average length of stay are higher than budget, both on the month-to-date and year-to-date basis. But again, the average length of stay initiative is an ongoing ramp up, and we just talked about that. So we expect to continue to see improvement as we move forward.
Visiting hours will be over in 15 minutes.
August results for deliveries, surgical, cath lab cases, and outpatients are all favorable against budget. Year-to-date results are still a little unfavorable due to the soft volume we saw in July. Case mix index, which is based on discharges, is slightly lower than budget by 0.05, but higher than the last 3 months. We've had kind of a run of low acuity, if you will, on a CMI, so it's nice to see it bump back up. Emergency department visits are off budget by 141 for the month. Surgical and cath lab cases. Overall, surgical cases are favorable by 16, up 3.5% when compared to the budget. Main drivers in surgical joint replacements were unfavorable by 13. We had an ortho on vacation.
How dare they take time off?
All right. And then cardiac was unfavorable by 6. This was offset in cases, not dollars, by endoscopy, which was favorable by 28 procedures, and then other surgical, which was favorable by 6. I'm sorry.
Oh, no, never mind. I just.
Neurosurgical cases were on target. So total cath lab cases are favorable by 6, 193 to 187, which is consistent with the expectation given the pickup. We were ramping into those new physicians, and so August was that first part. And then the IR doctor started September 14th, as I mentioned, Dr. Doshi, and the new vascular started in early October. Our operating indicators on the productivity, productive FTEs were unfavorable against budget of 1415 by 21.7 at 1436.7. Non-productive FTEs were unfavorable to budget of 185.7 by 17.6. Our total FTEs for the period were unfavorable to budget by 39.3. While total FTEs per adjusted occupied bed of 6.32 were lower than the budget of 6.48. But it was more than prior year at this time at 6.18. Total FTEs of 1640 were unfavorable to the flex budget of 1611 by 30. Gross revenue of $197.7 million for August was close to being on budget, off $61,000. Inpatient gross revenue of $111.2 was unfavorable to budget of $117.7 by $6.5 million. Outpatient gross revenue of $86.5 was favorable against budget of $80 million by $6.4 million. So a little less than $100,000 difference to $61,000. Payer mix for August was as follows. Government-sponsored patient revenue made up 71.3% of total gross revenue, and this was favorable to budget by 0.5. Commercial patient revenue, the HMO PPO, made up 26.5% of total revenues, and it was slightly unfavorable to budget by just under half. Private pay continues to run a little high for the fiscal year. July was at 2.4, if you recall. This one is at 2.2 of total gross revenues. This is unfavorable to budget by 0.8. And about half of the private pay patient number, 2.2%, were out-of-country patients. So now we're looking at the GASB report, and as a reminder, GASB, Governmental Accounting Standards Board, is an independent organization, establishes financial and accounting standards for state and local governments. August 23 GASB report was a month consistent, excuse me, with our expectations at gross revenues only off $61,000. Some of the initiatives, again, are ramping in. We're starting to see the benefit of those. Total actual deductions as percentage of revenue, second row from the top, is 76.75 versus a budget of 76.89, was slightly favorable. August's net operating loss, so just toward third line up from the bottom of the chart, is, third line down, is negative $1.221 million, which is $494,000 unfavorable to the operating loss that was budgeted of $737,000. Moving down to the net income. Net income for the month was negative $743,000 which is about a $2.6 million improvement from July's performance. And so we're still trailing our budget for the year. We're at 3.2 on a negative basis for net income year-to-date on a budget of negative 727. So the FASB, or the Financial Accounting Standing Board, remember in this one, unrealized loss on investments, net interest expense on GO, and property tax revenues are removed. And so you'll notice that on the net operating income, the number was 1.221 on the GASB, and it's 1.7. Middle of the page, negative 1.7 on NOI, so that's a loss. And then down below, net income on GASB was 743, and under FASB it would have been 1.4. So on the EBITDA side, August, EBITDA generation was 1.75 on a budget of 2.4, generating an EBITDA margin of 3.7 on a budget of 5.2. Year-to-date EBITDA is 1.738, or 1.9% on a budget of 5.8%, or 5.6 million. And I will stop there.
Any questions on Tom's report? Good, let's move on.
All right, I will do the hospital operations for September. As Tom said, we are continuing to focus on some of the initiatives that we've been working on. And so you can see with September, we had patient gross revenue of $189.5 million, was unfavorable to budget by about $1 million or 0.5%, higher than September of 2022 by $421,000 or 0.2%. Inpatient gross revenue of $104 million was unfavorable to budget by 10.1 or 8.8%, and $9 million or 7.9% lower than September of 2022. Outpatient gross revenue of $85.5 million was unfavorable compared to the budget, was favorable compared to the budget by $9 million or 11.8%, and 12.3% higher than September of 2022. Moving on to the key statistics for September. Average length of stay of 5.09 was favorable to budget by 5.21, by 0.12 or 2.3%, and was lower than the September of 2022 length of stay by 5.45. In September, there were 6 adult discharges with lengths of stay greater than 30 days, ranging from 32 to 56. Excluding those outliers, our average length of stay would have been 4.81. Still in-house, at the end of the month, we had 3 patients with lengths of stay over 30 days, and they were 33, 37, and 52. So we're doing a better job in terms of that piece of it, though one of the challenges you'll see, as our observation days, they came in at 417, which were unfavorable to budget of 267 by 150 or equivalent days, and longer than the September of 2022 by 175. This is something that we are looking at. The cases have not necessarily gone up, but the length of stay of our observation patients, which you can see in our days, is gone. So we have a team that is a multidisciplinary team that is taking a look at that and knowing where we need to focus our attention.
Kimberly, when we look at observation days,
Yeah.
we look at a 24-hour day. Are we able to look at observation hours?
We do.
And what happens as far as billing and
Yeah.
recovery for the hours versus days?
Yeah, so we do look at less than 24, 36, and then over 40, and the 48.
Mhm.
Really, in terms of, there are benchmarks around getting out within 24 hours.
Right.
Is really, that piece of it. And then, you want to be less than 48 the 2 midnights from that. And it does impact in terms of, that's why finance is part of this team that's analyzing in terms of it, because really, again, they don't meet, those that are in observations, they don't meet the inpatient criteria. That's why they're put into observation. And so the expectation is they would get the test or whatever that they need to to then transition out to that next level. I don't know, Tom, if there's anything else or from that standpoint, yeah.
No, I think it's clear that like Kimberly mentioned, our observation length of stay for the mean hours has gone up significantly.
Yeah.
So we're working with a group to figure out why, whether it's, delays in consults, delays in imaging studies getting done, more imaging studies that are needed being ordered. There's a lot of different things that are being worked on as far as that observation number. But as Kimberly mentioned, it's not the number being admitted necessarily, but it is the mean length of stay for our observation patients that's contributing to that. And, there is a team of us that are looking into more specifics around the observation patients and length of stay. That's the highest we've seen in a long time.
Yes, it is. I know.
Total days is the most we've seen in quite some time.
So we've got more work that we are doing on that we've got the team working on it. So moving on to inpatient average daily census of 145.5 was unfavorable to budget of 152.9 by 7.4 or 4.8%, and lower than the September 2022 average daily census of 159.1. The combined average daily census of 59.4 was unfavorable to budget of 161.8 by 1.5%, and 4.7% lower than the September of 2022 average daily census. Moving on and looking at the discharge trends, discharges of 817 were unfavorable to budget of 880 by 63 or 7.2%. September 2023 discharges were 48 or 5.5% less than September of 2022. Moving on to patient day trends, patient days of 4,364 were unfavorable to budget of 4,588 by 224 days or 4.9%. Patient days were 410 or 8.6 fewer than September of 2022. And again, as you can see, our length of stay had dropped, which does impact our patient days. And the biggest area was adult med surge days at 2,300 were unfavorable to budget by 139 days or 5.7%. So, but we are running under our length of stay, which does contribute to that. Looking at our surgical trend, our total surgeries in September of 438 were consistent with the budget. Surgeries were 20 or 4.4% below September of 2022. Inpatient surgeries at 179 were unfavorable to budget by 1. Outpatient surgeries of 259 were favorable to budget by 1. So very, very much right on. If you look at our surgical activity broken down, as mentioned, we had one of our joint replacement surgeons were out of town, so we had both of our main surgeons had performed more than had been budgeted, so that we were over by 15 for joint replacement. Neurosurgical cases were under by 6, and cardiac cases were under by 5, and endoscopy cases were under by 5. And other surgery was pretty much right on in terms of surgical activity. Looking at our cath lab, the cath lab cases for September at 165 were 15 or 8.3% unfavorable to budget of 180. They were 14.6% more than September of 2022. Again, we do have our new IR physician that started in September, and our new vascular surgeon just started in October, so none of those volume numbers. I think they started last week. She started, Dr. Joyce Blue. So our goal is to work with her to get her ramped up in the cath lab. Breaking down our cath lab activity, cardiac cases were unfavorable to budget by 11, and were 3 less than September of 2022. Our non-vascular cases, non-vascular interventional radiology cases were favorable to budget by 9 or 18.4%, and were 45% more than September of 2022. And then our peripheral vascular cases were unfavorable to budget by 13, 30.2%, and 30.4% fewer than September of 2022. And then also neuro IR cases, you can see, was right on with the budget. We did have a big month for deliveries. Deliveries for September of 142 were favorable to budget by 21 or 17.4%, and were 28 more than September of 2022. When we look at our year-to-date total deliveries, they came in at 384, which is just 4 off of our total budget of 388. So, as I said, we did have a busy September for deliveries. In terms of our non-ER outpatient trend, those visits, 8,173 were unfavorable to budget by 204 and fewer than September of 22 by 6.2%. This is driven by our lab visits being down 10.7%, given that at that point we had still budgeted for the COVID testing and being done for those being admitted and procedures. But that was partially offset by our cardiac rehab visits that were up, our diabetes education visits, our prenatal diagnostic clinic, and also X-ray. So, as I said, the main driver really has been how we budgeted in terms of the lab visits for COVID tests. Moving on to our emergency room visits, they came in at 4,842. They were unfavorable to budget by 2.1%, but if you look at September of this time, we were 2.2% more than the prior year. And we did have a number of higher level of emergency room visits which you will see when you look at the breakdown of our gross revenue recap, which is on that next page. So surgical cases were consistent with the budget. Our gross revenue, though, in surgical cases was favorable to budget, in terms of unfavorable to budget by $292,000. We still have some late charges that we're working on with also not only in surgical cases but also in cath lab that we are following up on. Moving on to the room and board, revenue was unfavorable to budget by $627,000 or 1.8%, and patient days were 4.9% unfavorable to budget. Our deliveries were favorable to budget, as mentioned, by 21, and revenue was favorable to budget by $505,000 or 14.9%. Emergency visits were unfavorable to budget by 2.1%, but due, as I mentioned, to the higher acuity level that it came in at $428,000 or 3.4% favorable to budget. Cath lab cases were unfavorable to budget by 8.3%, and revenue was 26% unfavorable to budget. So again, we're looking into some of the missing charges in cath lab. And then ancillary services revenue was favorable to the budget by $741,000 or 0.8%. And so it's higher outpatient services that resulted in that $7.1 million more than revenue than budget. So that ancillary services was above budget. Moving on to the preliminary payer mix, in terms of government-sponsored patient revenue made up 71.9% of total gross revenue. That was right consistent with our budget, but it is higher than the prior year's percentage of 71.3%. HMO was 2.4% of gross revenue, which was higher than the budget of 2.3%. And higher than the prior year's percentage of 2.3% of gross revenue. PPO was 23.5% of gross revenue, which was lower than the budget of 24.3%, and also lower than the prior year's percentage of 25%. And lastly, as Tom said, we've continued to see a higher percentage of private pay, 2.2% of gross revenue. We had budgeted 1.5%, and it is higher than last September 2022 of 1.4%. There was a total of $1.5 million in charges from out-of-the-country patients. So that's continued to.
How do we do on recovering any of those charges?
So, we do our best. We do have, we work with an outside agency, and we're actually looking at putting some other processes in place in terms of that too. So we've got some other pieces that we're working on as when they come in to ensure there's a guarantor.
Do you think we're just seeing more international travel this year? That's why we're seeing it?
I think so.
As opposed to the last 2 years?
Yes.
Yeah.
I think there's more of that happening.
Is it successful at all at looking at relatives or people here in the community that are friends or relatives or whatever?
Yeah. So that's the other piece in terms of looking at putting in processes in place so that if there's somebody that is a guarantor for that person coming in.
Right.
So, and then, as I said, we work with agencies that other hospitals work with to help also track that down, but it's not the same for the reimbursement.
Right.
So, yep. Looking at our productivity indicators, as Tom mentioned, this is an area that we're continuing to focus our attention on. Our productive FTEs were unfavorable to budget by 0.8% at 1,438.3. Non-productive FTEs were unfavorable to budget by 11.8 or 6.1% at 206.3 FTEs. Our total FTEs of 1,644.6 were unfavorable to budget by 23.4 or 1.4%. Looking at our total FTEs per adjusted occupied bed came in at 6.14, which was favorable to the budget of 6.35 by 3.3%, but was more than the prior year of 6.04. Moving on to our other preliminary outpatient statistics, looking at our Whitman clinic visits, they were unfavorable to budget in September by 1,209 or 7.4%, and 111 visits lower than September of 2022. We did in primary care providers, we did have a few providers that were out due to being illness in terms of that, so we had that. And then mainly in our specialty care was unfavorable to budget by 8% due to open positions. We have an open position in psychiatry and orthopedics. We're also showing the vaccination clinic, and you can see in terms of we were off by about 100 vaccine visits for the month. We continue to hold our clinics and doing that for flu and other vaccines. Looking at our outpatient visits, they came in at, for DevCo, 1,927. They were unfavorable to budget by 11.8% for September. And really in terms of being driven by mainly their Washington Outpatient Rehab Center. As you've heard in the past, we've had some challenges with staffing there, and once again, we had somebody out. Now we did hire somebody or brought somebody in October. So the volume is very dependent on whether or not we have, it's been a staffing challenge in terms of just people not necessarily leaving to go someplace else in this area, they're leaving the area altogether. But I know the director there has been working on the staffing.
Demand for those services is certainly there.
Exactly. I know I know he's just recently talked about the work that he's doing in terms of trying to, if he can get fully staffed and then being able to reduce the wait time, and I know how important that is. So that is definitely something that he's been working on. Also, the Radiation Oncology Center, you can see, was off budget by 10.5%. I know they've been very busy and just in terms of having other patients that are lined up in terms of that coming on in terms of treatment too. Moving on to our key financial statistics. As you can see, our days cash on hand for September ended at 133 days, an increase of 3 days from the prior month. A lot of this was due to the reimbursement of capital expenditures from our general obligation bond proceeds and project funds. Our days in accounts receivable in September were 57.7. This is 0.8 days more than the prior month, but continue with 4.7 days shorter than September of 2022. And a lot of this was in terms of the timing of the month and the time in getting the cash in the door. And then lastly, with charity care at 219,000 in charity care adjustments in September of 2023. And then lastly, one other piece I want to just talk about is the summary for the quarter of the unhoused patient activity. For the 3-month period from July to September of 2023, there were 575 patient encounters representing 354 unique unhoused patients. Of the 354, 98 had multiple encounters with a hospital, and we had an estimated total unreimbursed cost of care of about $1.4 million, and this, as you know, includes the food and clothing, pharmaceuticals, and DME, among other things for these patients. So that is the month of September in terms of for this that quarter.
Any other questions? Okay. Move on to calendar.
All right, moving on, I would like to start with the Employee of the Month for October, Karina Flores. She's a certified nurse assistant in medical imaging. When patients need an X-ray, CT, or an ultrasound, they may be experiencing some pain, apprehension about what the test may find, or general embarrassment. This is where a good medical imaging transport team member can make all the difference. Karina Flores started her career at Washington in 2015 as a member of the Environmental Services Department. While working there, she became a certified nurse assistant and 2 years ago transferred to medical imaging as a transporter. Karina enjoys interacting with patients and understands that she can calm their fears by explaining what the procedure will entail and how long it typically takes. I try to figure out what they are most concerned about and then address that, she explains. And once we get past that, I try to distract them from thinking about it. Her manager, Katrina Montano, describes Karina as helpful, flexible, and motivated. She is part of what makes our medical imaging department a cohesive unit. Born and raised in Fremont, Karina attended Ohlone Community College where she studied film. As a self-described film buff, she could not have imagined that one day she would be working in the hospital setting. But Karina has found her new calling, and she is motivated to expand her training and roles here at Washington. She is currently a full-time student in an LBN program. She finds her classes and scheduling challenging but rewarding, and she hopes to continue her healthcare career and someday become a registered nurse. So that's wonderful. All right, moving on to the calendar. Just want to talk a little bit about what's been going on in the community. We heard some of that through our breast health presentation for the Women's Center. But as you can see, in September, we have been busy. We've been doing a number of education events on Facebook Live and YouTube, as you can see by Dr. Imam. He's a relatively new gastroenterologist with our medical foundation, and he did a number of presentations. We were also part of the City of Newark and their benefits fair at the police station. We have some pictures from the Newark Days Parade and the Community Information Parade, or fair. We also had Dr. Kostouris doing a presentation on orthopedic surgery. Also, we were part of the City of Fremont Disability Resource Festival. Also, one of our newer family practice physicians, Dr. Kedial, talked about staying healthy to retirement and beyond. And, as you can see, she presented on Facebook Live and YouTube. And also Dr. Eftemia talked about genetic testing for breast cancer risk. Moving on, also you can see we did a number of events in October, and in terms of we did host a blood drive in Anderson Auditorium. We were part of the New Haven Schools Foundation Mutt Strut. Then also did a presentation at Acacia Creek. You can see also we're part of different health fairs too. Moving on to some pictures showing some of the events. You can see this is Newark Days, and you can see Dr. Epen and I were part of that parade in a very nice car, I shall say. This individual was kind enough to to drive us in. Also, and as mentioned, Dr. Inman talked about dysphagia and reflux at Carlton Plaza. Also, we were part of the Fremont Disability Resource Fair, and then also, as Christina mentioned, the HERS Walk and Run. We have a number of health promotion events coming up. You can see those, and also go to our website if you're interested in signing up for any of those that we have happening, especially those on Facebook Live. We have Dr. Kunwar that is going to be talking about our neurosurgeon, one of our neurosurgeons that's talking about anatomy preserving spine surgery. We also have an important topic about how diet affects diabetes and blood sugar on October 23rd by Dr. Timothy Lin, also with the Medical Foundation. And also, as mentioned, we do, because it is Breast Cancer Awareness Month, we do have talks on breast cancer towards the end of the month on October 26th for Thermo Fisher, and that is being done by Christine Mickelson and Tammy Tyson too. Then moving on the last couple ones that we have, you can see Dr. Dearborn, our orthopedic surgeon, is doing one on Anderson Auditorium and also on Facebook Live, and then also participating with the Foundation Walkathon. Again, next we've talked about Think Pink, and that's coming up, and I just want to encourage everybody to sign up, and you can do so online or by calling the number. It's on our website too, and it's on October 19th. Also want to mention, very excited to say that our Radiation Oncology Center went through accreditation, and that's a very good, went through and was very strong in terms of accreditation, and so been reaccredited for the next 3 years through the American College of Radiology. So excited about that. And lastly, of course, on Saturday, October 14th, is our 37th annual Top Hat Gala. I think we have over 620 people that have signed up to attend, so very excited about that. And you can also see November 9th, we are doing another charitable giving and estate planning seminar too. So we have a lot of community activities going on for both September and October.
Thank you, Kimberly. We have no action items tonight. Cheryl, do we have any announcements? We have no announcements. At this point, we have no further business. This meeting is now adjourned. Thank you all for your attendance. See you all at Top Hat.
Great.
Thank you.